So we here have an anatomy-based question where they're essentially asking, based off of this coronal CT imaging, where is the contents from the orbit of this patient herniating into? So here the patient was punched in the face and has since had pain and double vision. Now, they give us a little bit of history about the patient's past medical history and all of that, but then they say there's significant soft tissue swelling around the left eye. So, here on this imaging, we can see that this is the left side, this is the right side, and so it's consistent. This side has a little bit more swelling, and we can see this little defect here. This white bone here is the orbital floor. And so we can see that there's some herniation of some mass going inferiorly. And so they're essentially asking, what is this pocket of air? Air is going to be black on a CT versus bone here is going to be white. So now they're asking us, what is this that it's going into? Now, if we were to try to kind of identify our anatomical landmarks, we see here that the ethmoid air cells are going to be around here. And so there's no herniation going into there, so it's not a. Frontal sinus is actually not depicted here. It's actually going to be kind of higher than this, and it's going to be a little bit more anterior. So we're not going to see the frontal sinus here. The inferior conchae are going to be here. It's not super air-filled, and there's clearly no herniation going in over there, so that's not the right answer. Now we have maxillary sinus. That's over here. If you were to tap on your cheekbone, right underneath that is actually the maxillary sinus. And so it's this big air-filled cavity where we clearly see that there's herniation going into the maxillary sinus.